Hi, I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Today we have with us Dr. Sakirat, who is going to tell us about the process of practicing in Norway after BDS. She completed her BDS from Divya Jyoti College of Dental Sciences and has been practicing in Norway since 2014 after completing her exams. She completed her post-graduation Masters in Aesthetic Dentistry from King's College London and currently runs her own clinic. She was also a contestant in MasterChef Norway 2020, where she reached the top 7. Hi, Dr. Sakirat. Thank you for taking your time and coming to answer the questions of all the young dentists. But in this video, we'll be only talking about how to go to Norway after BDS. I love your Instagram page, and I would like to have a separate interview on how did you get into MasterChef also,
Yeah.
because yours is one of the interesting Instagram pages which I keep on following. Keep up
Thank you.
that Instagram page.
Thank you so much. I think this is very interesting that we can do this, and we've been planning it for such a long time now, actually. And I hope I can answer the questions that you're looking forward to, and it could help people who are aspiring to come to Norway after their BDS.
Sure. So my first question is, most of our degrees, the BDS ones, are not approved in Europe, including in Norway. So
Yeah.
what is the step-by-step process if someone has to try and enter into the dental system out there?
Yeah. So basically, yes, of course, as you mentioned, that we do not have a direct authorization to work in Norway. So you basically have to go through this authorization process, and all the information is actually available on this site that we can share later. That's called the Helsedirektoratet. So you've got a three-tier system, I would say. You have to, of course, learn the language first of all, actually, and you have to get your papers, all the papers that you were like all your syllabus in detail, whatever you've done in your BDS, whatever you've done in your dentistry, all the projects, everything. The paperwork has to be super detailed. You can't expect them to be just sending them like, I've got this prosthodontics, itne hours, and all of that. But like in prosto or like in any other subject, how and what you've done, how many hours have you used in fillings, how many, like it jitna detail, or like all the detail you can get, it should be on documented. And colleges and universities are very helpful in that, I've seen. If you go and tell them that you want it, they'll provide you or help you with it at least. And then the other part is that when you have actually applied for that, you have to send your documents to this site that I've just mentioned. And in that site, you have to after you've sent all your documents, they see all the documents and tell you if your degree is at par with the Norwegian degree. So if they take it at par, then you can go further with the process, and then the exams come into play. The first exam will be the national subject, that's called national fag. In that, you've got two-tier system again. You've got medicine, medicament, basically it's called, now I know the Norwegian names. I'm just trying to translate them. That's why taking a little bit of time to switch on the languages. So it's just to dosage of the medicaments. That's one of the subjects which nurses and doctors have usually, but every medical person has to clear it. And the other one is about the laws in Norway. And after you've completed that, then you can actually get a temporary license, and the temporary license helps you to work under guidance of another dentist who has authorization here in Norway for 6 months. And in those 6 months, you have to clear your other dentistry exam, which is comprised of practical and theory exam. That's either taken in Bergen. You have to basically get a seat into it. You just don't get it like apne aap hi nahi mil jata. You have to have a way into it, basically. So yeah, it sounds a very long process, and it does take time, but it depends how fast you do the language, how fast you do the other things. Like did my language in 6 months, so it's all like time based. And of course, if you are here in Norway, it would be much easier, I would say, to pick up the language, to pick up the system. So yeah, it's a long process, but it's not impossible, I would say. It would take time, it's time consuming, but then if you're here and you want to pursue your degree and you've got passion for dentistry, then it's not difficult.
Okay. So is it difficult or easy for someone who does not have a spouse or a relative in Norway to get into the system?
Yeah. So that's there the visa comes into play actually. So then we're talking about the immigration department. They do have the site called udi.no or do udi.com. In that you can find the ways you can get other visas. Earlier they also used to have this job search visa that you can apply for, and you can come to Norway and search for a job. But I think if you're doing that way, then you have to have at least, your authorization should already be in kind of place. And that's something where it clashes, because you can send your documents from India to get the directorate to see if the degree is at par. But it does still take time to come here, and you'll not be able to do all of it in like 1 year ka time, because then there's this thing of like, is the seat available in that session, because there are only 2 sessions in a year when you can give those exams. It's not available like every time. So yeah, it's a little difficult if you're not coming here on a family or a spouse visa, or like a longer period of time.
Okay. So you can start the process in India, but eventually it is better to be in Norway to get through the process quickly.
Yeah, you can send, because this also actually because I've been doing these sessions earlier also. So I actually came to know through somebody who's applying right now also. And so she sent her documents to the through the website that we've been talking about. And so they'll be checking it, and maybe if they see if it is at par, maybe we'll know how that procedure goes further. I can also update you if I come to know about how it went for her. But as I said, if you're learning the language, that is again something very important, because all your exams are in Norwegian. So if you do not know Norwegian, you cannot do all those exams, Pehla National Fag Wala, or like any of the exams. So for learning the language, it is possible in India. Of course, people learn French, German, and all the other languages all the time. But it's about, the pronunciation, being in the atmosphere, that kind of pumps you to do it faster. So I think it aids if you're here.
You clear the exam in 6 months, but is it
Yeah.
easy to actually clear it so fast? What's the
Yeah, I
average
think
time
if you,
taken?
yeah, because I think so. In the sense that because you've got these some of the words that we in Norwegian call loaned words that are from English. So some of the words are kind of overlapping. They have a different pronunciation, and they have a different spelling, but you can kind of understand. Like authorization, for example. Authorization in English is authorization. In Norwegian, it is authorization. So you write it in a different way, and it's a but when you read it, like, that's what helped me. When I was reading Norwegian, I could understand what they were saying by picking up those words that are already in kind of English. But of course you have to understand the basics of it. There are different words, and there the alphabets have to be like, E is not E in Norwegian, it is A. I is not I, it is E. So that all of those confusing things are in the starting. But if you give it time, as I said, if you're here on a visa that can like a spouse visa or a family visa, then you have time to get into the zest, और आप उसको पूरे अच्छे से time दे सकते हो. So the first 6 months I only did Norwegian. I mean, I wasn't working anywhere, or I wasn't doing anything, because I came here on a spouse visa. My husband is from here. So that I would say, people would say that's why it was easier. But no, we didn't talk in Norwegian at home. We talk only in Punjabi, actually, because we want a daughter to learn the language from India. So I think that's something that is difficult if you're sitting in India, that I would say,
Okay.
but not impossible.
For Norwegian, you have courses out there, but for dental exams, do you have courses similarly?
No,
Once a person comes to Norway.
nobody prepares you for any kind of course. But yeah, the national exam, as I call that, for that you have 1 month's course. So
Okay.
that goes pretty smoothly, because you go to those classes for a full 1 month. You're taught how to do things. I mean, the exam that they're expecting you to clear in the end, uska sara guidance, they give you all the guidance and all the help. And so you just need to go with the flow there. The exam, when I told you about the medicament dosage exam, that exam you have to clear it 100%. You cannot have one question wrong or two questions wrong.
Oh,
Then you have to repeat it. So they want 100% score. And I kind of understand it also, the reason being that you cannot dose a patient wrongly.
Understood.
It's as simple as that. That अगर आप dosage ही गलत दे रहे हो, so you might be harming the patient. So that little error is not allowed there. But for the other exam, in the law one, I think that there it's more about writing. It's very theoretical. So once you read it, and I think being from India, we are very used to the whole culture of reading it
And
through,
writing
and
it.
yaad karna, and learning it all by heart. So that I think is not a problem, but it's all in Norwegian again. So that is why it's very important that you have your Norwegian
Focus on the
done.
language.
Mm.
Understood.
That is the first step. Yeah, that is the first step.
So you even did your masters once you went through this entire authorization process.
Yeah.
So is it
Yeah.
possible for someone from India who's just completed their BDS to come out there and do masters?
So I did my master's from King's College London. That's
Okay.
where I did my master's in aesthetic dentistry. Yes, so not from Norway. As I
Okay.
said, if you want to do masters in Norway, you have to get your BDS cleared here first. Only then they will accept you for the masters, and it's not in English; it's in Norwegian. So that was also one of the reasons that again I opted King's also, because and the other thing was I could combine it with work, because I was traveling there, and then I could come back and do all my we had to do patients in our own clinic. If I do the masters here, I have to go back to university and give my 3 years completely, sitting the say like it is in India, right? You
Understood.
go for proper MDS. So that flexibility I did not have with the masters here. That's why I opted for the London masters.
Understood.
So yeah, you have to clear your BDS has to be accepted here. Only then you can do, and again in that also you've got these particular seats in particular slots. So if you want to do something is that's not available, you cannot do it that year. Then you'll have to wait for the next year. It's very limited seats, very limited seats.
Understood.
So some say, yeah, if you know people and stuff, that might help, because if you've done your BDS from the same university, you know the professors. So it's very that scenario based
Understood.
scenario. Yeah.
I
Mm.
understood. So what is
Yeah.
the salary expectations do someone have once they are finished with their initial process and once they finish
Yeah.
with their complete process with the exam?
So the salaries, the word that they use here in the starting when you just done your BDS, or the word that is used here is called assistant dentist. So you're not an assistant, but you're a dentist, but you're not the main dentist, but you're the secondary dentist, I would say, not the primary, but the secondary one. So
Understood.
when you're that, especially when you just have your license and you have to work under guidance, I worked free actually, because
Wow.
yeah, so I was working free for that 6 months of period of time. Because I was basically I wanted to take in imbibe as much as guidance I could. So it's very difficult that you go and demand, that okay, this is what I need to be paid or stuff like that. So I did that. But when my whole process was done, then I got the job in the same clinic I was working earlier, or I would say free, or I would say it was kind of an internship. I would
Understood.
use the word that, not like working free, but because I was always guided and helped, and still like I have a very good relationship with the same dentist, and that's the same clinic I'm bought in also. So yeah, the salary after, yeah, of course you have. So as I said, when you enter as an assistant dentist, so you are given percentages. Usually that's how it works, because you're working in somebody else's clinic. So it might be a percentage of 30%, 70%, the other one, or a 40, 60. They're very different percentages, and there's no guiding force that says okay itna nahi de sakte ho, you cannot have that much. And it's patient based, how many patients you're doing. So uska you'll get 30% or 40%, and the rest will go to the
Understood.
clinic. So
So
it's
it
very difficult to
basically
give
depends
a
on
exact.
your skill set.
Yeah,
So
I would say. And how
initially,
many
the first
patients
you
you
need
can
to
do.
learn how to do work. So it's you have to be
Yeah.
okay with working for a lower
Yeah.
pay or no pay.
Yeah.
And once you learn that, it depends on how your skills is and how many patients you can do basically.
Yes. So it's a very number based scenario. But on an average, I think, yeah, I don't know how much I can, like if you say if it's a 30%, let's take it on the lower end. still you'll have like, I think, yeah, 20,000 to 25,000 crowns maybe in the starting. Um, Again, depending on how much you're working, because even here now some clinics have started having, double shifts, not the same
Okay.
dentist, but in the
Understood.
morning somebody is working, and then in the evening somebody else is working on the same dental chair. Not
Yes.
a lot of dentists are doing that, but some are doing that. So
Got it.
you can get do double shifts also, like you can have this one in the morning and the other one in the evening somewhere else, or maybe in the same clinic. So that's what we call here vakt. Vakt means like emergency. In the evening only dentist open for like emergencies. Nobody is really working all the time, because 8 hours
Understood.
yeah. So I think, yeah, 25,000 crowns with that kind of a percentage, if you're having 30% and you've got good amount of patients. So I think that is what we're thinking. It's maybe, yeah, 2.5 lakhs starting.
Understood.
Mm.
What is the advice you'll give to the young dentists who are trying to take the route you have taken and go through this entire Norway process?
Then they might mock me for this कि पहले तो शादी करनी पड़ेगी नॉर्वे में. So that's not the thing I'm trying to say. But yeah, I think if you're already here, I'm following some of the, as I said, dentists here very closely who've come from, India, Nepal, and other places. And I'm trying to help them as much as I can on my personal basis. But I would just want to say that if you're already here, it is easier. If you're sitting in India and planning to do it completely by yourself, it's a little difficult. By yourself, I mean the visa part. Of course, when you come here, you can do everything by yourself. It's not difficult. You can get part-time jobs, even if you're not working as a dentist, but you can work at the shops. You can do so many other things so that you can have your normal bread and butter scenario happening. Of course, when you're here, so the process kind of starts to go move faster. But of course, if you're in India, and you can try and send your documents and get that, if you know you're going to come here. For example, if somebody's already engaged, or somebody knows he or she's going to come here, so you can start with those documentation process in India, send them, let it be done. When you come here, you can focus only on your Norwegian. And when you're in India, your documentation is easier to if there's something missing, you can always go and get it like pumped up and do it faster. Because I
Understood.
had to travel especially to get my documents again in detail. So that's one thing. And as I said, I've already said that documentation has to be very detailed, as detailed as possible. Like you've got this DCI, Dental Council of India syllabus. So basically, that whole thing, all you've done, has to be there. So it has to be this whole book, basically, in detail by your university, or stamped by your principal. So that has to be, any case, you cannot just photo stat it and send it. Of course, it has to be validated by your university. And the other thing I would also want to suggest is, when you're here and you're learning the language, just as I said, for free, join any clinic. Just be there like an assistant to the dentist, because everybody here would not mind the free help, I would say, because every cost in Norway is super expensive to have assistants or everything. It's all very expensive. So if you're earning well, but you're also like giving away a lot of money, because the taxes are high and everything is like, but you get a lot of the advantages also. I want to
Understood.
say tax bahut high and you're like, getting overkilled. Your children's education is free. There's so much. The health system is completely free except the dentists. They are private. But till 18 years of age, it's all free for your children. So things like that, you've got lots of advantage when you pay that amount of tax. I would suggest that, joining any clinic, just calling them, even if you don't know the language, go there. And because you can pick up the language faster, you can also pick up the language that the dentists use here. So that would help you in your exam as well. You can understand what is the daily patient scenario here, what kind of cases are you seeing in a daily practice and everything. So all of that would help you, because some people just keep sitting at home and thinking, okay, I've not done the language, I have to do this thing first. And then they land up into going into the system of like exam dena hai, and then everybody gets scared, in the sense that, oh, I don't know what they're going to ask and everything. So joining this clinic would really help you in the fact that you can just understand the working the thinking and everything around the dentistry in Norway, because it's different than India, in the sense
Understood.
that majorly you'll see caries is the major problem. You'll very seldom see some big tumors, or things like that we might see. I would say a little more often, like oral cancer, stuff like that is not common here. Then periodontics is also not like so prevalent, but it is, of course, in some of the patients it is there. So hygiene in general for a lot of patients is very nice. So that's
Understood.
something very good, that you can analyze your clinic, the one you're working in, and you can understand how things work here in Norway. So
Understood.
these are the important advices, I would say. The paperwork in detail, join a clinic as soon as you come here. You start calling people. Even if you don't know them, aisa kuch nahi, you don't need to really know them, but you can say you're a dentist, you've done your BDS from this and this place. You can go and ask for a meeting. If they don't want to have you there for the whole time, you can ask them if you can come only in the summer holidays. You can come for like 1 week, 2 weeks, whatever you get, just take it. That's what I also
Understood.
did.
So
Yeah.
it's basically getting the experience and getting how the system works.
Yes,
That helps you
yes.
later
Because
with
that
your
will help you in the
exams.
exam. In the exam, yes.
Yes, understood. Thanks a lot. Thank you for taking time from your busy schedule and joining us.
Thank you so much. I hope this helps. And as I said, I'm available on my Instagram, and a lot of other dentists have already asked me, because I've done some other videos also. So if there's any other question, you can of course ask you,
Yes.
or you can ask me,
We'll
or
be
you can.
posting your Instagram page on our Instagram page. To do not
Yeah,
go forget to go and check it out.
yeah. Don't do it. Don't forget. But thank you so much. Yeah, it was nice meeting you and talking to you.
Thank you.